Hi everybody, Coach Doug O here. Today we're not going to do a typical workout, but we are going to do a workout for our lower back. And the reason why we're going to do a lower back workout is because we want to alleviate or prevent some lower back pain. You can also strengthen your core, these exercises, your legs, and also some of your arm muscles. Exercises can also increase blood flow to your lower back if you are having issues, which may reduce stiffness and speed up the healing process. So, with that being said, if you got some lower back pain or you want to prevent lower back pain, let's try these exercises together, shall we? Now, if there's something you can't do, you do what you can. The exercises that we are going to do today, though, are bridges, a knee to chest stretch, right and left leg, lower back rotational stretches, right and left, some lateral leg lifts, and some Supermans. Now, if you want to get yourself, change into something, like shorts, comfortable clothes, totally fine. Otherwise, I'm going to be doing this right here in my work setting, so clothes shouldn't be too much of an issue. But if you sweat like me, maybe it's not a bad idea. Otherwise, let's get into it, shall we? For your bridges, what I want you to do, if you have a spot on carpeted flooring, or if you actually have a mat, I would recommend using the mat just for that little bit of support. For your bridges, this is going to mainly focus on your gluteus maximus, which is one of the largest muscles in the buttocks. This is going to engage the muscle with your hips, and then also it is important to keep these strong to help support that lower back. Okay, so even though we're talking about strengthening the back, we do have a lot of other smaller muscles, okay, or bigger ones that help us out. So for your bridges, what I want you to do, come onto your back side. Okay, right now we're starting with the knees bent. Hands are just at your side. I'm going to use my hands to brace myself. I'm going to rest my head down. I'm going to keep that neck supported. What I want you to do is I want you to inhale, exhale, and bring up one vertebrae at a time. So lifting your butt off the mat. What I want you to do is hold this straight line for about 10 seconds. Keeping that tummy nice and tight. So I want to keep it tight. Okay? And then lower down. Now, if you want to hold for 10 to 15 seconds, if you want to do 10, if you want to do 15, totally fine. Let's do it again. Inhale. Exhale, bring it up. Raise it up so we have about a straight line from our shoulders, our hips, and our knees. We don't want to be too low. We don't want to go too high. So once again, that straight line. Breathe it out. Lower down. We're going to do this one more time. Inhale. Exhale. Raise it up. Keep that tummy nice and tight. Hold it here yet for 5 more seconds. 4, 3, 2, and 1. Let's lower down and relax. From here, we're going to stay down on the ground. What we're going to do, though, is now bring in that right knee. Let the left leg go down. Single leg stretch. Now, pull that knee into chest. Once again, you're going to hold this for about 10 to 15 seconds. We're going to do the right, left, right, left, right, left. Okay? And relax. Bring the other knee into chest. Other leg come down to the ground. Let's hold it here for 10 seconds. Bring that knee in nice and tight. And relax. Let's switch it back out. Right knee in. And hold. Looking good, everybody. Looking good. You can keep your head down on the floor if you'd like to. And switch. Left leg. This is the second round for lefty here. You want to pull that knee in as far as you can comfortably. And then let's do last time right. Bringing it down. And last time left. After this one, we're going to do the lower back rotational stretch. Okay, so what we're going to do for that one is we're going to have our feet up in tabletop position, which means my ankles are about as high as my knees, and my knees are roughly over my hips. I'm just going to put my hands out to the side, okay? That's my stability point here, okay? Head down. What I want you to do is I want you to bring it down to the right side. Bring your knees down to the right. Knees can be touching. Hold it here. My knees are not hitting the ground. Okay, we're going to bring it all the way over to the other side. Once again, keeping the ankles up high. Holding right about here. You're going to feel a good stretch. Breathe. And bring it back over to the other side. So we're going to do it 3 times. Right, left, right, left, right, left. Once again, we're roughly just going to hold that for 10 to 15 seconds. Once again, you might also notice you're stronger on one side versus the other. That's typically what happens when we have low back pain. Bring it over to the other side. Is you got one side that's a little tighter than the other. So even if it feels good, keep stretching both sides. And last time left. And hold. Once again, keep your hands on the ground. If your hands come off the ground, it means you went too far with your feet. And relax. Okay, from here, we're going to go to a lying lateral leg lift. And this is going to work the hip abductors. Okay, these muscles support the pelvis and can help reduce strain on the back. Okay, so you can keep your hand down here. You can go right here. You can go up to here, whatever you feel comfortable with. But we're going to do 2 sets of 10. And we're going to lift that leg up and then bring it back down. So the rotational stretches is supposed to help relieve tension in the lower back and in the trunk. This one is a strengthening exercise. Okay, that's going to support the pelvis. All right. Looking good, everybody. Now, what you could do is you could put some resistance on your leg here. You could use your hand to kind of push down a little bit, go against your hand here, or you could use a weight and relax the bottom here. We're going to do 2 sets. If you want to alternate legs, that's totally fine too. But let's do 10 more over here. As you can see, I am going nice and slow. I'm going nice and controlled. That is something that we should consider doing so we don't go through pain, but also too, have your legs do the work, not momentum. There you go, everybody. That's halfway there. So after we do this side, we're going to just sneak on to the other side. Here is 7, up, 8. As you can see, I'm also not having my foot hit the other one, just to keep some constant tension on there. And relax. Good. Okay, let's switch over to the other side. What you do right, you got to do left. Now, if for some reason like you can't go for 10 reps, what I want you to do what you can. Do 8 reps or do 5 reps. Or if you can't hold for 10 or 15, hold for 5. We have goals, but sometimes we just have to work up to them, right? All right, looking good, everybody. Here's 5. Are you still going nice and slow? Are you still holding that leg up? Right here before it hits. Looking good, looking good. Now, how often should you do your stretches? You know what, to be honest with you, I do these daily, every other day. Whatever you feel that you can do. Relax. We are going to do one more set of 10, and then we're going to finish with our Supermans, okay? All right, let's bring the leg up. Here we go. Now, as we're doing this, are you sweating? Are you getting warm? Hey, movement is a good thing. Movement is a good thing. All right, everybody, looking great, looking great. Keep it going. So even if you don't have back pain right now, folks, this is still very good to prevent it, okay? Get blood flow in the body by moving. Strengthen your back muscles and your upper body and your lower body. Last one, and relax. All right, that last one that we're going to do is going to be the Superman. What we're going to do is we're going to lay onto our chest. All right, now a person needs a strong back extensor to maintain good posture. The Superman is going to help you, okay, with those back extensors. So what we're going to do, arms out, legs out, and we're just going to lift our hands up, our shoulders up, and our legs up same time. And we're just going to hold it here for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Breathe. Bring it up high enough again so you can feel it in your lower back. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. We have one more time. Breathe. Bring it up. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Excellent job, everybody. All right. So, your takeaway today. Performing exercises to work the core muscles can prevent injury, increase stability, improve flexibility. People with low back pain should also pay attention to the general posture and how to carry objects, and then also identify movements that can be responsible. Keep an eye on those things so you don't keep on repeating that. Anyone experiencing low back pain that is severe or does not go away with gentle stretches and exercise should make an appointment with one of our nurse practitioners here, okay, to see if they can help you out as well. Once again, if any of these back pain things exist, stretch. If it doesn't work, see your nurse practitioner here at the Three Winds Clinic. Or better yet, check in with your health coach, Doug Laughlin, and I can help you out too to make sure you're doing the right form. Ladies and gentlemen, thank you so much for your time. As always, I appreciate your effort. Have a good rest of your day. Stay strong. Stay smiling. All right, everybody. Thank you so much, and we'll talk to you soon. Bye now.